The Italian health service, like many Western health services, decades is falling to pieces. Cuts every year occur. They spend less. More doctors and nurses abandon the health service due to working conditions. There is no money for renewal of equipment, medical equipment. Hospitals are falling to pieces, and so on. And the number of hospital beds every year gets cut, and lesser public service for the citizen. While I was in hospital, a nurse told me, a professional nurse at Gisanelli Pisa, said, if the health service here in Italy goes along like this, continues to be dismantled, underfunded, in the end, it will become private. Like in America, that means you have to have a health insurance policy when you go to a hospital, because we're all private in the end. And most people can't afford this. People are already struggling now with the socio-economical problems occurring in Western countries due to geopolitical events around the world. And there are good doctors and nurses to begin with, but those doctors who followed the health narrative during the pandemic, and those nurses as well, they're the worst kinds you can bump into if you need to be hospitalised or you have to go to the ER. Hours of waiting, probably left there for a day or two in the ER until they finally guess what's wrong with you. And then afterwards, a amnesty, which then used here in Italy when for doctors and nurses who practice that experimental pharmaceutical on people, which, you know, the results, people had suffered injuries and even deaths from it. They want it to be applicated in health service because they said we're underfunded and we are under stress at work. If something happens, we don't want to be blamed if a patient loses their life. If a patient loses their life, probably due to your incompetence, due probably the fact the patient wasn't strong enough to respond to the therapy. It can be many things, but if nurses and doctors start seeking an amnesty when they cock up, no way. They're not to be people to be trusted. And the old guard of medicine is disappearing because they're going in pension. And obviously the new generation, how they study medicine in universities is absolutely insane, as I've been informed by. And if you want to become a specialist, you won't be paid by the National Health Service for that training period. Once upon a time it was like this, but not anymore. Therefore, in the end, you could find yourself a really bad specialist in the future. Or probably when they're specialised after a few years, they fuck off. They go overseas to work or in the private sector, which pays a lot more better. Don't blame them. And we have these so-called public managers, LAS, they call them here, which should put more efficiency and be more careful on what they spend the money on in their health district. No, it has become an absolute money pit. It's not run like if it was a private business or whatever, which it should be, with more efficiency and more attention on what the money's spent on, the necessities of the hospital or the health district itself. No, just squandered for like this. And plus you've got, as I said, cuts every year. What does that bring to? A lousy health service, long waiting lists for an operation or even for a specialised exam as well. And I said, it's the pandemic. Incompetence and inefficiency is the problem of the health service today here in Italy.